Leadership takes many forms. In Lesotho, a group of women and girls chose to lead through service.
Before working with CHAL, our main focus was recruitment of girls. Our programs, we have a number of programs here. We have the Self Smart, we have the menstrual hygiene, we have the girl powered nutrition, we have Rosie, they normally call it Rosie. So when we came to work with this project, it opened our eyes because we are recruiting girls from 5 years. So when we started working with CHAL, that is when we got to engage with parents, with the caregivers, with the health facilities about the challenges facing the 0 to 5 children. Because before we worked with them, we didn't even know how to read the booklet, understand what this means when the child has to go for immunization.
From CHAL, CHAS, and Gavi, LGGA began building the knowledge and skills needed to support immunization services in Mazanod catchment area.
When we got to the facility, the data was not appropriate. The data was haphazard, and they wouldn't allow us to access the real register. They had the other notebooks where they would allow us to use and to check the numbers, but they wouldn't allow us. But with time, I had meetings with the nurse in charge, and I explained to her that we are not here to expose maybe what we're not doing right. We are here to assist you to do what is right. So I think from that those meetings, that is where they had to change their beliefs that maybe these people are here to go and report to CHAL that this is what we are doing and this is what we are not doing, because their data was outdated.
So LGGA's presence within our midst was very helpful because they were able to go to the facility, which we are not able to do, to see if their kids are still coming for vaccinations, also to come and help us update the registers so that our reports can reflect the true picture of our work. Because when we are not updating the registers, it means when we compile our reports, they give a picture which is not true. The nurses or the healthcare providers here at the facility, at that time when they were here, we only had about, were we three? We were only three. One registered nurse and 2 nursing assistants. So it was not easy for us to go out with them. But our village health workers would always be there to support them. Now I think we are already experiencing some challenges since January after they left, because before, when they were still here, they were helping us to update the registers, so the gaps were minimal. But now that they are not here, it's like we are going back to before they came. There are now villages which don't have village health workers, so it's going to be hard for us as the facility to trace or track the children who are missing their vaccinations.
Working alongside community structures, LGGA began visiting households, tracing children who had missed vaccines and encouraging caregivers to return to health facilities.
We had to sit down as a group and plan on how we are going to disseminate the information that we want people to know about. So what we used to do was to have papers where we've written down the information that we want to disseminate, and we also had to translate it into Lesotho so that they'll be able to understand it more when we are speaking in the language that they understand. And then we also went for door-to-door mobilization, everything. We had a village health worker all the time because we wanted them to to be open to us if they have somebody that they have been working with. So if we wanted to have a public gathering, we usually talked with the village health worker coordinator, who then talked to the village health worker who is designated to work with the village that we want to go to. And then the village health worker would help us coordinate with the chief, so that the chief would be able to like call on his people for us.
Ke bone ge fihletse le bana ba netse go sa nagana gore ba teng ka hara motse. E ne thusana le gore ba tswetse o tlo utlwa mabaka a bona a fapaneng. Ba bang ha ba tlisa bana hobane ba sena baka, ba bang bana ba setse le bonkgolo, ba bang ha o a fihla ha ona bukana o kgona ha tsena bukana e kae kore ke ditori tse ngata, empa re bone re sebedisa hantle le bona ka nnete haholo.
The success of the project depended on collaboration. Health workers, community leaders, volunteers, and caregivers all played a role in ensuring children received life-saving vaccines. Behind every statistic is a child, and behind every child is a family whose future becomes safer through vaccination.